Hi, I'm Dr. Michael Workman, and wanted to spend some time talking about some of the questions that I always get when we're consulting with patients regarding breast augmentation. I've been doing this for 23 years, and there are certain things that just keep coming up. And I think the number one question is, who should I go to for surgery? And I think that in generalities, it really comes down to experience. I think that like anything else in life, you want someone who's been doing it a long time. And the example I use is, if you've been on your job for a while, were you better after 4 or 5 years than you were initially? Well, of course you were. And I think it's no different with surgery. I think that surgeons, the more experience they have with a given operation, the better they're able to do it and anticipate different anatomies and whatnot. So, in fact, when my wife had plastic surgery, and I won't tell what it was, I sent her to a doctor for a second opinion, and basically he was 55 years old. He'd been doing it extensively for the last 20 years. He had his own in-office operating room. It was accredited, and he was just a good person, very experienced, and that's what I recommend for all my friends. So next couple of questions that we really get a lot of questions on from patients are, what type of implant should I use? And I think I like to talk about the initial implant that we were putting in almost exclusively in the 90s and early 2000s, and that's the saline implant. And here's an example of a saline implant. And one of the things about the saline implants is outside the body they absorb air. So when this is in you, in fairness, it would be filled up with water, not unlike a water balloon. And the downside, you can probably see it, is that with the saline implant we get this rippling. And especially if one has thin tissue, especially on the outside lower portion of the breast, you not only will be able to feel the ripples, oftentimes you can see them. And this can be exacerbated if your implants are on top of the muscle, if one loses weight. And so what we're kind of switching to over in the United States and worldwide is the silicone gel implant. And here's an example of a silicone gel implant, and as one can see, it's much softer, it's much more natural looking and feeling. And this is one of the older, what we call 4th generation implants. And basically, if one cuts the outside shell of the implant, the silicone will come out, but it won't go back in. And so about 3 years ago, we started switching over to what's called a 5th generation implant, and many people have called this a gummy bear. And the advantage of the gummy bear implant is that if we cut it, the gel comes out, but it goes back in. So it maintains its form, and it's what we call form stable. My preference is this, the Sientra implant, although there are a number of other good companies that make these gummy bear or the cohesive type implants. Another question we get real frequently is, should I go with a textured implant? And as you can see with the textured implant, it has a coating or a texture that's very similar to Velcro in most cases. And so when one puts in a textured implant, rather than making a big wide pocket and allowing that implant to move up and down, the pocket is much smaller, and the theory behind it is that the tissue grows into it and keeps the implant from being able to move. I think that there are a number of good surgeons who use these. These were very popular back in the 90s, and there's a little bit of a resurgence. Personally, I don't like the fact that many times they're more likely to ripple because that implant can't move quite as smoothly in the pocket, and there may be a higher incidence of getting just a reaction or a fluid pocket around the implant. So In summary, we talked about the need for going to a experienced surgeon. I think you're probably better off to go with someone who is certified by the American Board of Plastic Surgery. That ensures that not only have they done a general surgery residency in most cases, they've done an additional 2 or 3 year residency in plastic surgery rather than just having taken a weekend course. We also talked about the fact that saline implants were very popular back in the 90s. However, 75 to 80% of American women are now going with the gel implant, and we're tending to go with the gummy bear implant, which is a cohesive implant, and it helps maintain its form. So hopefully that answers some of the questions that we hear all the time. If you have any other questions, feel free to email us, and good luck in your search for a better body.